Turning now to the growing concerns over a potential new Omicron subvariant. Health officials are tracking the variant spread in the United States. At least 22 states have already detected this Omicron subvariant, but it's not yet clear how dangerous the strain might be. It comes as Omicron cases continue to surge in the U.S., particularly in the West. And a new study suggests over 2/3 of Omicron cases are reinfections, almost completely replacing the previously dominant Delta strain. Meanwhile, many people are receiving their free at-home testing kits from the government this week. Despite the progress in COVID testing, Dr. Anthony Fauci warns we still have more work to do. Listen.
We believe we can get there because we have the tools with vaccines, with boosts, with masks, with tests, and with antivirals. That's what we talk about when we get to the point where we can, quote, live with the virus. But as Dr. Walensky emphasized, that is not where we are at this point. So we still have a way to go.
Dr. Ebony Jade joins us. Ebony Jade Hilton, excuse me. I apologize to that, Dr. Hilton. You join us now with more information on this. We're so very glad to have you. You are a professor of anesthesiology and critical care medicine, also the co-founder and medical director of Goodstock Consulting. So, Dr. Hilton, good morning to you. Let's just start with this new strain. Officials in Denmark, they say that the Omicron subvariant is more contagious than the original version of it, but not necessarily more severe. We know this is already in the United States. From where you're sitting, how worried should we be about this?
Right. You know, it's one of those things. I don't think we should have ever not worried about COVID-19. So let's take that for what it is. What we know is that COVID-19, regardless if it's the Omicron and the BA2, which is the new variant, the stealth variant of Omicron, every version of Omicron has shown itself to be not healthy for human beings, right? And so we are seeing that with this new variant, that the Omicron has multiple sublineages. And so it's not just the BA2, there's other branches of this Omicron that's now circulating within our globe. And what COVID-19 has shown us is that it will always try to be 2 steps ahead of us, which means that we have to be hyper vigilant, vaccinate and boost as many people as possible, wear those masks, so we can stop this telephone game that's happening with COVID-19 from person to person to person across this globe.
Yeah, and Moderna is now entering the clinical trial phase for an Omicron-targeted booster vaccine dose. What do you make of that? Is that necessary? Do you think that is where we should be putting resources at this point in the pandemic? And for people who are just wondering about this, what advice do you have for them?
Right. I think any tool that we can put in our toolbox is going to be one that is greatly needed. What we know is that we do have waning immunity. And what does that mean? That means that when we're looking at Moderna in particular, after 2 doses, within 1 month after you got that second dose, about 85% of persons had neutralizing antibodies against Omicron, which is fantastic. But about 7 months after that second dose, we saw that drop to 55% of people. So from 85% to 55% of people. Once that person has got those booster shots, we saw a 20-fold rise in the Omicron neutralizing antibodies, which is fantastic again. But we also saw that after 6 months of that booster, the levels dropped about 6-fold. So the question is, how do we keep up? Because Omicron showed us versus Delta that it was able to evade the immune system better. So the way that we keep us is we say, how do we revise? How do we update, right? We update our computers all the time. How do we update these vaccines to keep up with what COVID is now presenting to us? And I think it's important because we know there's young children who have not been vaccinated at all. If Omicron is a new version of COVID that we need to deal with leading into the future, then we may be in the future dates, we may be skipping the original mRNA vaccines that we've had already with Moderna and Pfizer. And this may be our baseline which we build on.
All right, Dr. Ebony Jade Hilton, thank you so very much for your time. We appreciate it. Now, if you have a question for one of our doctors, please let us know. They are here and ready to answer your questions. You can email us at morningnewsnow@nbcuni.com with your questions. You can also let us know if you prefer to stay anonymous.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.